The Program of All-Inclusive Care for the Elderly, or PACE, is a program for people 55 and older, and between the ease of enrollment and numerous benefits, it's a popular program for many aging adults. And I'm pleased to welcome Casey Escobedo today. She's the PACE Center Manager at Franciscan Health, Indianapolis. This is the Franciscan Health DocPod. I'm Scott Webb. Casey, it's so nice to have you here today. We're going to talk about the Program of All-Inclusive Care for Elderly, and easier abbreviated as PACE, right? So what is PACE?
PACE is a unique program, and it provides individuals who are 55 and older with an opportunity for comprehensive medical and social services that are coordinated and provided by a full interdisciplinary team, otherwise known as an IDT, of professionals in a community-based center, and services are also provided in their homes. These services that we provide are an alternative to nursing home care in hopes that PACE support can keep people out of nursing homes as long as possible.
Yeah, and of course, it's just a human thing, right? People are just always more comfortable in their homes, or typically more comfortable in their homes, so that totally makes sense. So how is PACE structured?
PACE is structured with an interdisciplinary team that meets regularly to construct an individualized plan of care. At the PACE Center, we have a clinic, we have a therapy gym, we have an adult day health program, along with the interdisciplinary team that works directly here at our center. We provide the medical care, rehab services, social activities, and even meals. We have a transportation team that takes care of transporting individuals to and from the PACE Center and to all other medical appointments.
Yeah, it sounds like you've got all the I's dotted and T's crossed. That sounds good. So what's the eligibility criteria for PACE?
For PACE, individuals have to be at least 55. They have to live within our individual service area, and they have to have chronic health conditions that qualify them for Indiana nursing home level of care. And also, they have to be deemed safe to reside in the community at the time of enrollment determined by the PACE interdisciplinary team.
Okay. And let's talk about the services then. What services can PACE provide?
PACE provides all the necessary services to ensure the health and safety of each individual, and that includes primary care, nursing care, PT, OT, speech therapy, labs, all durable medical equipment, such as walkers or any other equipment needed for safety in the home. We can send individuals to other specialists such as cardiology, audiology. We even follow individuals through hospice care if that is deemed necessary.
Yeah, it sounds really comprehensive, and I think it's pretty obvious, but I want to have you go through the benefits to PACE versus something like home care or a home health agency.
Home care agencies are very valuable, but they are limited in their scope and what they can provide to individuals and how long they can provide those services to individuals. So, anyone who enrolls in a PACE program is with PACE until they decide that they do no longer want to be with PACE. PACE has their authorized care provided by the interdisciplinary team. And so those individuals are able to meet with the interdisciplinary team, be assessed by the interdisciplinary team, and that is who determines when those services are necessary and how often they can receive them.
Yeah, definitely some benefits, and can't talk about something like this without talking about cost, of course. So, is PACE typically covered under our typical healthcare plans?
So PACE becomes the healthcare plan. We are the insurer and the provider. Individuals who have both Medicare and Medicaid, or who at least qualify for both Medicare and Medicaid, have no out of pocket costs for PACE. Individuals who are eligible for Medicare but not Medicaid will have a monthly premium that covers the entire program and their prescription medications.
And I'm assuming it's fairly easy to enroll, but take us through the enrollment process.
Absolutely. Enrollment does occur throughout the year, so we are not waiting towards the end of the year for open enrollment like other programs out there. So once the individuals go through the typical process, which includes an intake, a pre assessment, a visit to the PACE Center, and making sure that the financial status is set to go, they can start on the first of the following month.
That's nice. I know a lot of things have an enrollment, sort of window like once per year or something. So good to know that folks can do this anytime throughout the year. And I don't know why someone would, but in case someone wants to disenroll, how do they do that?
Sure, yes, absolutely. Everyone has the right to disenroll, and just like enrollment, participants can disenroll on the first of the following month after their disenrollment is determined.
That's perfect. It's hard to find any downsides to this. Enroll when you want, disenroll if you need to, usually covered in terms of cost, and it's so comprehensive and all that good stuff. Just in case folks want to learn more, in case we didn't give them everything they needed today, Casey, how can they learn more about PACE?
Sure thing. Everyone can learn more about PACE by calling 844-817-PACE, or they can visit our website at franciscanhealth.org/PACE.
/PACE. That's perfect. Well, thank you so much. These are topics that are important to get out. We try to cover the headlines for folks to give them the broad strokes. And then if they want to learn more, we're giving them the phone number and the website. So thanks so much. You stay well.
Thank you. You as well.
And to learn more about PACE, visit franciscanhealth.org and search the word PACE or call 844-817-PACE. That's PACE. And if you found this podcast helpful, please share it on your social channels and be sure to check out the full podcast library for additional topics of interest. This is the Franciscan Health DocPod. I'm Scott Webb. Stay well, and we'll talk again next time.